All right. Hi, everybody. I'm so glad to see all of you. Of course, Mike, Deb, and Kira. Thanks for being here again today. And we have a fantastic guest, Kelly LaRocca. We're so pleased that you're here, Kelly.
Thank you for having me.
Yay! I was saying earlier, I just absolutely love hearing what you have to say. You communicate things so effectively and very practical conversation and feedback. So I'm excited about today. For those of you who are joining us, thank you for being here. If you're listening to this recording, thanks for taking the time to do that as well. So as a quick reminder, Care for Nurses is a community created to provide nurses support, advice, and just be a safe place to get some conversation, right? A little bit of support, any challenges you may have. And it doesn't have to be about nursing. It can be about just life in general, right? But it's geared specifically for you and your fellow nurses. So again, we're glad that you're here. If you have any comments or questions during this, please use the chat feature. Mike will be monitoring that and let you guys share any comments that you may have. If you have any comments or question and you're viewing this as a recording, put it in the comments down below where it's posted, and we'll continue to engage into the conversation. So again, thanks for being here. I'm going to go ahead and pass it over to do a little intro about you and get started.
All righty. So my name is Kelly LaRocca. I'm a psychiatric nurse practitioner, and I'm also a primary care nurse practitioner. I currently see patients online as well as teach at Rowan College. One of my other positions is I work with Elizabeth as a peer support professional leader in terms of the support groups for nurses with impaired practice here in New Jersey. I have a lot of experience in both the medical and psychiatric settings, both inpatient and outpatient. I'm a very strong advocate for psychiatric patients as well as my nurses, my fellow nurses. And I'm happy to be here today. Thank you, Elizabeth. So today we're going to be talking about holiday blues. And according to the National Alliance of Mental Illness, a lot of times affectionately known as NAMI, about 64% of Americans are affected by holiday blues. And out of that, about 24% say that their symptoms are severe. So what is holiday blues? Holiday blues is usually people experience some temporary feelings of anxiety and depression that usually start around November, and they go in through the seasonal time. And a lot of times it's associated with the pressure that comes around the holidays for some people. A lot of times they have unrealistic expectations about what they think the holidays should be like. A lot of times people may have experienced some losses, so it can bring up conflicting feelings, a lot of sentimental memories that as people are continuing to grieve lost loved ones or people that they may not have been as connected with as they would have liked to be, whether it be family or friends. Financial stress, because as you know, a lot of people overspend during the holidays. And so that's another contributing factor. But also tied into this is seasonal affective disorder. And I don't know if anybody on the panel with me has also had any participants or nurses or, patients that they may see themselves that may also have some seasonal affective issues that can also play into the fact that people may be experiencing some mood changes during, November and onward. This is a lot of times when I talk with patients, it's triggered by the time change. For a lot of people, that's when symptoms start to kind of emerge. And what I usually do, like if I'm treating somebody with seasonal affective disorder, oftentimes I'll put them on an antidepressant, say, and usually beginning of October, because antidepressants take about a month to kick in, so that by the time we're doing the time change, that medication is in full effect for them, for those that meet criteria for medication. However, other factors that contribute to seasonal changes in terms of maybe some people experience mood changes, and this kind of ties into these holiday blues as well. some of the factors I already mentioned, is that a lot of times there might be changes in people's routines. They used to go to the gym. A lot of people don't like to go to the gym. Now it's dark outside. It's harder to get to the gym. There's not as much motivation, because we've lost that hour of light. A lot of times people are consuming, more alcohol than they may have. And as you know, alcohol is a CNS depressant, central nervous system depressant. There's a lot of over commercialization that goes along during, these fall months in preparation for this big, huge holiday that's coming, that is so triggering for a lot of people for some of those things that I mentioned. It's also a time that people start to reflect, who are they connected with? Who are they disconnected with? So all of these factors can influence your mood change. So in addition to, the factors of just the holidays themselves and that, some of those factors that I mentioned, then you have separate issues that can contribute to mood changes, and the lack of light really should not be underestimated, because at the end of the day, my first line treatment for people that might be suffering for seasonal affective disorder, and again, it usually starts around November, and it usually lasts till about, I'd say, spring is when the mood times of change, is light therapy. That really is my first line treatment, and for anyone first, because I'm personally a provider that I like to do non-pharmacologic strategies first, and if somebody's symptoms persist, then we're going to go into more pharmacologic agents. But so you have the light change, so that impacts, everybody feels that in some context, right? Absolutely. Some may not develop symptoms, but everybody feels that in some context. So then you pair that with the holiday season and all of those factors, like I mentioned, the over commercialization, maybe being disconnected from people, financial pressures, unrealistic expectations, that people can have pretty significant mood changes. And some of those mood changes can certainly mimic a major depressive disorder. And a major depressive disorder in the psychiatric world is someone that is experiencing a depressed mood or a loss of interest or pleasure in activities that they traditionally enjoy. They have one of those two symptoms, in addition to they could have significant appetite changes. They could have weight loss or weight gain, trouble sleeping or oversleeping, a lot of fatigue or lack of energy, lack of motivation. They can feel hopeless, indecisive, kind of feel guilty, ruminating thoughts. And then some people even have some very, very hopeless thoughts about, whether or not they still want to be on this earth or not. So it can be very significant. So people can have a mimic. Now, for a major depressive disorder, someone may have those symptoms persistently every single day for greater than 2 weeks. However, when people are experiencing holiday blues, oftentimes the symptoms that I just mentioned are what they are encountering. And so, there's this pressure, though, because the one thing that we do here in the United States, and I'm sure greater, is, if you turn on a commercial, you see happy families and, you see people buying and all these decorations. And there's a lot of people that aren't able to, participate in the holidays in that manner. So there's this comparison that people may do from their homes to what they're seeing on TV or now even more globally, social media, right?
I was going to say social media is huge.
Exactly. So you have this window of what it should look like, right? And a lot of times, unfortunately, people do compare themselves to other people. And as a result, they get a lot of some of those symptoms that I mentioned, So some of the things that I like to think about in terms of just some practical tips to kind of get through the holidays is, first off, really being realistic about what your holidays are going to look like. Okay. Now, if you're hosting, for instance, you're only one person. And yes, you may have little elves in your family to help you, right? But you're still only one person. So you really need to look at the day and say, what can I and what can't I do? And be okay with that. And sit to yourself and say, because at the end of the day, when you're thinking about the holidays, the most important thing is being able to spend time with people that we care about. That's the bottom line. even the food,
Mhm.
the presents, that's all extra dressing. That's just wonderful, an extra added bonus. But what's most important is really just being able to spend time with people that you care about. And so sometimes people put so much pressure on how the day should look, what they should have, what they should buy, that they lose the joy of the season. So I think just kind of reminding yourself that the people that are in your living room on that day are all people that care about you because they all decided to come, right? And that's what's important. And to really just focus on that kind of fellowship that you experience by being around people that you really care about. So that's one thing. The other thing, and asking for help. That's the other thing that I want to tack on to with realistic is make sure you're asking for help. Um, in this country, a lot of times, women, we multitask and we take on more than we can chew sometimes, and we are just going to plug along and push through it. And what we really need to do is ask for help so that the holiday season is enjoyable for everyone, including yourself. Okay, so that's one thing. The other thing is that, plan accordingly in terms of your financial status if you choose to buy gifts, right? I was just talking to a patient, right before this call about the holidays and financial management. And, remembering that the new year is going to come, and we don't want to create an additional stress for us in January when all these credit cards come in, right? So
Mhm.
if you're already suffering some little bit of a holiday blues or seasonal affective disorder, that's just going to make it worse. I can tell you that. If all of a sudden now you're like, how am I going to pay for all of this? So kind of being realistic about what your budget is, and then celebrating your budget. Now, one store that I really, especially for younger people, that one store that's really great is Five Below. I don't know if you guys have a Five Below in Virginia, but we have it here in New Jersey, and it's a store that has from T-shirts to makeup to phone cases to snacks to mirror.
All of the stuffies that my 7-year-old daughters love.
Exactly. So there's all of these different places. And so a lot of times there are cost effective places that you can go if you would like to give somebody you love a small token or a small gift. To kind of really be more mindful that it doesn't have to be some expensive thing from Nordstrom's. I don't know if you guys have Nordstrom's down there. It doesn't have to be something like that. It could be something that's equally as meaningful, but also cost effective, so that you can give somebody something, but at the end of the year, you're not also consumed by overspending. So really being, realistic about that. Okay. I think that's really important. The other thing about the holiday blues and some tips to kind of getting through that is planning ahead, right?
Mm.
So a lot of times you are invited to so many parties, or you're going to this event or that event. And it's really important to decide what you can and can't do. Okay. Now, all of us want to attend everything for all the people that love us and care about us, but we have to know our own, physical and mental limitations, right?
Right.
To say, is this really going to bring out joy? Am I just doing this because I'm going because I should go? So
Right.
already that's taking some of the joy out of it, right? Because if you're already
Mhm.
having that conversation and you're not even there yet, you've already taken some of the joy out of it because it feels like a hurdle, right?
Mhm.
So I think really prioritizing, events that you would like to participate in, okay? And really just letting people that if you aren't able to attend, to let them know, that you care about them and you're there in spirit and you look forward to seeing them at a different time. It doesn't have to be an end all be all. You can certainly see people that you weren't able to see during the holiday season after the holidays. After
Right.
the holidays. So it doesn't have to be, like you're slighting someone. You just make a date at a later time.
Yeah, and I think that's a good point, that you don't even really owe a full explanation. It's
Hmm.
okay to just have a redirection, like you said. It doesn't even have to be a hard no if you're not comfortable
Hmm.
saying no. A
Right.
little plug for Kira's article about tips for saying no if you wanna go
Yeah.
research that. But it doesn't have to be a hard no. It can
Hmm.
be, I like when you said, "Hey, I'm sorry I'm not able to attend." Don't even apologize. "I'm not able to attend. I'd love to be
Hmm.
there, but can I connect with you on such and such date?"
Exactly.
Yeah,
Exactly. And I think that's one of the biggest strategies is because people really do overextend. So if
absolutely.
you're already struggling with some mood changes that make you feel, low energy, fatigue, lack of motivation, that's going to compound those feelings.
Right.
So kind of prioritizing what's important. And again, if it's somebody that you do care about, you just take a rain check. Just take a rain check for a later date that works for you. The other thing is maintaining some healthy habits during the holidays, because when you go to someone's house during the holidays or a Christmas party or something of a work event, food is paramount, as we know during the holidays.
Yeah.
Food is paramount. So, kind of surveying, say, because when people overeat, right? It doesn't leave you with a satiated feeling, it leaves you with an uncomfortable feeling. So
Guilty feeling.
if
Yeah.
you're already experiencing holiday blues, you're already mentally uncomfortable, right? That's one way to say it. So, evaluating, you say, okay, I know I'm going to this party tonight. Sometimes I even encourage people, eat some healthy things before you leave so that when you get to the party, maybe you're saving just a couple of good things left over. So you set yourself up for success so that you're not eating, because a lot of times the foods are rich, the sauces are rich, everything is heavier. Nobody is using light butter or light cream. Okay, they're not, right? That's the holidays. Nobody's using that. So if you have a healthy, some type of healthy meal before you even attend, you're setting yourself up for success. And you say, well, you know what, maybe I'll do the dessert there. Something like that. So the other thing is, after a party or, if you have a loved one to partner with or, in between, take a short walk. Because that's a really nice way, if you say, oh, I ate a little more than I should have, take a short walk if you can, around your neighborhood with a partner, of course, if it's in the evenings or later at night. But, just take a, 10-15 minute walk. Nature does have a way of, even if it's crisp and cold, wrap yourself up. It's okay to go out in cold, just dress appropriately. And that little bit of exercise will not only stimulate your gastric delay, gastric emptying, it will also improve your mood as well because you're doing something positive. Okay. So the other thing too is also encourage family and friends to partner with you when you are doing some of your self-care activities. Okay. A lot of times people don't prioritize self-care activities during the holiday time, but you do need to prioritize them because there's a lot of holiday stress between the hustle and the bustle and the events. So, have somebody partner with you that who is your person that traditionally is someone that helps you feel calmer, or, you engage in an activity. Don't refrain from doing things that already make you feel good, because sometimes what happens is people say, oh, I'm doing this, that, or the other thing. So they don't prioritize things that help them to feel happy and healthy, on an ongoing basis. So we don't want to get away from our healthy habits in that regard. The other thing is making sure we're still keeping a regular sleep schedule. Okay, because I know that there's parties and I know that there's events, but you don't have to stay till 12 p.m. or 12 a.m. I'm sorry. You don't have to stay till midnight to enjoy the party. You can say, oh, it's 10 o'clock, and, because at the end of the day, you still have to get up the next day to go to work. Right. So you don't want to be doing so many activities and events that, you're waking up the next morning, you're already feeling like, oh my gosh, I have to get through the day. So really evaluate and do as best, to the best of your ability to stay on some type of sleep schedule. It's really, really important. It's recharging, because if you're already feeling fatigued, it's just going to make things worse. And when we're tired, it also worsens symptoms of depression. So we don't want to do that. Okay. And make sure you're drinking plenty of water. People drink more alcoholic beverages during the holidays because everybody has wine or spritzers or cocktails, fancy cocktails, all kinds of things, right? So make sure that you're drinking plenty of water, and those of you that are in recovery, bring your mocktail with you. You can still participate and have a fun drink of your choice. That can be a cranberry spritzer. Okay. So, for those people that may want to go to parties, but that are in recovery, you take the initiative to give yourself a special drink. Okay. Because it's not about the alcohol. Sometimes it's just about feeling like you're having something special because it's a special time. Okay. Right. And also know when you're in recovery when it's time to leave. Okay. So always be mindful because your mental and physical health is paramount. The other thing I would say in terms of getting through holiday blues, it's really important to let people know how you are feeling. So I mentioned sometimes those symptoms of depression that people feel with the holiday blues, around that November, December time. And it's really, let people know that you might be struggling, reaching out to your supports. Okay. Let them know, this is the second year without mom and I'm struggling a little bit, so access your supports so that they can support you. People will not know you're struggling unless you let them know. And I know sometimes it can be challenging asking for help, especially nurses. Nurses are so used to being the end all, be all, carry all. However, we are human too. And so I really do encourage people to, if you are struggling, to reach out to people who will be there for you and help you navigate the situation, because you don't have to navigate it all by yourself. And the other thing is, when you're having these feelings and you don't reach out, it's going to increase feeling of loneliness. So if you're already feeling lonely or you're feeling isolated or you're missing someone, it's going to compound that feeling if you're kind of shying away from everything. Those feelings will intensify. So, a lot of times when you're reaching out to family and friends, they can pull you, come on, come with us when you don't feel like it. And a lot of times when people end up going somewhere, even though they don't feel like it, when they get there, they're so glad that they attended. I can't tell you how many patients have told me that. I didn't want to go, Kelly, but I thought about you and my friend kept calling. And then they say, I had such a good time. I'm so glad you went. I hear it consistently. Sometimes it's just hard to get that motivation going. And that's where the family and friends can come in to help give you that little push. Okay. The other thing is make sure you create a relaxing environment for yourself in your home. Okay. Because sometimes people are like, oh, my house needs to look like this person's house or that person's house. Have your house comfortable. That's your safe space. So make sure that you're creating a relaxing environment for yourself during this time. If you like candles, put your candles on. What are things that you can do in your own home life that can help you to feel a lot more comfortable, at peace, things that bring you joy and things like that. And I think that's really important because when we're surrounded by things that are comfortable and bring comfort, we're going to feel better. We're going to feel better. Mm-hmm. You had a question, Linda? Somebody had a question in there. Okay, I wasn't sure.
Yeah, I sent her a message and I'm not sure how to turn on her mic. We're kind of new at this system. So if somebody wants to speak, I'm not really sure how to do that.
It kept coming up. I wasn't sure if I was supposed to address that or not.
No, it's okay. And it's okay. I know Linda, so I'm fine calling out Linda. Hey, Linda, if you have a comment though, or a question, I'm not sure how to unmute you. So if you could click on the chat icon and type it in, that would be amazing.
I think you'd have to actually invite them as a co-host to bring them on. Which
maybe we can test that another time. Or Linda, if you want to text me, if you can't find the chat, please do that, and we can.
There you go. Hey Kelly, I have a question about these tips are all so great and so helpful, and I appreciate it so much because I'm definitely already stressing the holidays. I've 3 Thanksgivings where I've cooked like tons of food. I'm working on Christmas, the whole thing. But what I am finding the most stressful this holiday season so far is like other friends who are kind of, they're not practicing these things that you're talking about. And so it's like, it's a boundary issue, right? Like, hey, if you're going to overspend, that doesn't mean that I need to
Correct.
overspend. And if you're going to be anything else, it doesn't mean that I need to, right? And it's hard when you really care about those people because you want to be like, no, but this is going to make it worse, like you were saying, right? But
Right.
you also don't want to be the know-it-all who's telling people what to do.
Right.
Any tips for that?
I would say this is when I use my I statements. Okay. Because I statements are a lot less threatening. You say, you know what, I'm really working on my financial management this year. So I'm making a point to make sure any of the gifts that I give are within my budget. Okay, that's one straight in. I'm really working on my stress management. And so I'm really prioritizing, things that are really important to me. And I'm making plans to see people that I can't see during the holiday season afterward. I am doing that. So a lot of times people can receive that when you make it about you.
That makes a lot of sense instead of you should, or I'm scared that you
Exactly.
are.
Exactly. Yeah. So those are some things. And I think you bring up an important point is when somebody gives you this gift or you think they're doing this pressure to feel like you have to give equal. And just to kind of remind yourself to say, it's not about the gift. It's not about the gift because that's the commercialization part of the holidays, right?
Yeah.
And that's not the meaning of the holidays. The meaning of the holidays is really to be around and spend time with people that we care about. So, to say, if you'd love to give me that gift, that's wonderful. Thank you.
And another, we have this situation actually. And, for us, there's family that we don't see all year. We don't get to take them to lunch. We don't get to do that. So we wanted to, send a little something. And then, so for us, we had an idea and I thought this was fabulous. That, hey, if you want to send me a gift, feel free to donate in our honor to a cause of your choice or something like that, which is another great idea because then you're not having to worry about overspending. They can donate whatever they want. They get a benefit to it, but they're doing something in honor and, of you as well. So I thought, just thought I'd throw that in there. But that's a great question, Kira. And I liked the response of using I statements, Kelly.
I love that.
I heard, first of all, you have so many fabulous tips. I would actually love if you have them jotted down. I could go back through and re-listen, but I'd like to create maybe a little cheat sheet for everybody and link it in the comments when we get it posted. But something I heard you say kind of way back in the beginning, actually before I jump to that, in lieu of gifts, maybe do some family games to really foster. There's so many, if you go on just even Google holiday games that don't cost a lot, there's some really cute ones out there to kind of foster the communication. And then you get a lot of laughter, which is also good for, the holiday as well. So anyway, I wanted to put that in there, but I want to kind of go back to the beginning. And I heard you say something about light therapy. I had never thought, now I experience it when it gets dark, my everything in me changes. Yes. I don't see as well at night to drive, so I don't drive. Things. I had never really thought about that being the beginning, and you had made this practical comment about light therapy. Could you explain a little bit? Is that something that we can do as consumers and find something?
Yes, actually, light therapy is, like I said, my go-to when we're thinking about someone with seasonal affective disorder, like you mentioned. Okay. And so what happens is the idea is that depending on the severity of your symptoms, you can purchase and they have a lot of them now on Amazon. They have even a desk size, which I encourage a lot of my patients to take. They're just kind of small. It almost looks like, for those of you, that use makeup mirrors.
Okay.
Okay. And, they have the different lighting on the makeup mirrors. It's something similar to that you can get about that size, like, let's just say a size of a, 9x11, so you can prop it on your desk and basically you get a certain amount of wattage. And it's usually, if I remember correctly, it's usually like, 10,000 lux of light, something to that effect.
Okay.
And depending on your severity of your symptoms, you can use the light for about 10 to 20 minutes in the morning. You can use it in the evening. And they have found that the light exposure improves symptoms related to seasonal affective disorder, because a lot of times it is about the light. It really is about the light. So you can purchase them right on Amazon. I encourage you to do different reviews. I never say one particular one, because then Kelly LaRocca will be associated with one particular one. So I encourage my patients to do their research. But a lot of patients do have ones that can sit right on their desks that they turn on. And depending on my patients, I'll say, you sit down, you're about to start work, I want you to do 20 minutes. Okay. Some patients, I'll say, do it again in the middle of the day, and then some at night, or some during the day, some at night, and that light exposure.
Wonderful.
Oh,
Kelly, I just knew this would be
great.
Full of so much, and I can keep going and asking questions and more information. So I think I'd love to extend the offer for you to come back.
Yeah. I was thinking, Kelly, too. We're just about out of time too. But some of the stresses I think nurses find are within the workplace itself. Everybody wants off on Christmas Eve. Everybody would like off on New Year's Day. How do you manage that? Covering shortages. So if there's anything we could focus on, again, a little bit more of the stress within the workplace as well as as the holiday.
Well, one of the things that I think is, staffing is an issue in nursing, particularly since, COVID came to hit us all. It's really changed the face of nursing quite a bit, because we have a lot of people that chose to leave nursing, unfortunately, due to burnout and things like that. However, there's a lot of us that are still very much in nursing, and it can be challenging when you don't have enough staff. And long ago, when I used to work on an inpatient psychiatric unit, one of the things that I would do is I would try to turn my unit during the holidays into a festive place, because your environment really does impact your mood. Like I was mentioning before, make sure your home environment is creating and relaxing and loving during this holiday time. So, some things you can do is just kind of make your unit a little bit more festive. People respond to decorations. They do. There's a lot of study. People respond to decorations. Be. And you can decorate for all the different cultures, so to speak, right? But have that in place. The other thing is, when I used to work the floor, I would volunteer before I had children. I would volunteer to work Christmas Day, because, nurses work, 7 days a week.
Santa Claus wasn't coming to your house. Yeah,
exactly. So, even sometimes asking staff to talk among themselves, because we did that back in the day. We would do that. We would talk among ourselves. How are we going to do through the holidays? Who has what event? What can we do amongst ourselves to make it better, versus just management saying, yes, you can, or no, you can. So I would encourage the staff to talk amongst each other to see, a lot of times, a lot of resolution can come if people get together and really understand why somebody else's wants this day and why it's important to them. Like I had one staff member, even when I was in management, her big day was Christmas Eve. She was like, I'll work any other time for any person if I can do Christmas Eve. And somebody else really wanted Christmas Day. So I would really encourage staff to talk amongst each other versus just, management saying yes or no.
Good ideas.
Everybody be happy? Probably not, but I can tell you a good 95% of people, it's amazing how much you can really work it out. So that's the other thing that I would say. And I would encourage on the day of the holidays to have your own holiday potluck. That was something that I've always done with my staff, is have a holiday potluck. Everybody bring in something. It could be your own kind of cultural dish, or it could just be a sign-up sheet. But just because you're not home with your loved ones doesn't mean you're not with another type of family, because we know our work. A lot of times we spend more time with your work family than you do your home family. So there can also be a celebration on the unit as well. So that's something else I would offer.
All right. Thank you.
You are very welcome.
Oh, Kelly, thank you so very much again. It was such a pleasure, as always, to just talk to you, but really just get so much from what you have to say. So thank you again for being here.
Thank you.
All right. Well, we ran over a little bit today, but it was just too good to stop on time. For those of you, Kelly had mentioned, support systems are so important. If you are struggling finding a support system, don't have a support system, or maybe you do, but you're nervous on how to talk to that support system, you all can come here, right? Come in here, post comments, send us an email. If you're needing to talk to someone, there's some resources for some different hotlines that are available for you guys to just call and really talk to someone, and they can have additional resources. So please feel free to use the space as a support system for you during the holidays. But if you also see somebody, a coworker struggling, encourage them to join as well, right? Because the more we get involved, the more conversation we have, the better the resources can be for everyone. So again, Kelly, thank you so very much. I hope you have a wonderful holiday season.
Thank you. Thanks for having me. Have a wonderful holiday, everyone.
Thank you. You too.
Bye-bye.
Great job, Kelly. Thank you.
Thank you.